because pressures are going to be important in movement of the air. But here's the thing, depending upon where you are atmospherically, so to speak, okay? Like, for example, where we're located here in Virginia, we're pretty much at sea level, okay, which has a certain atmospheric pressure. But if we were to go to the mountains in Colorado, we would not be there at sea level. We're way different in our atmospheric level. And yes, air composition is different, and therefore external pressures are different. So it depends upon where you are atmospherically, okay, as to what an external pressure on your breathing will be. But then we're going to also find that we have pressures of air that are within our alveoli themselves, as well as pressures of the gases in our blood. All right, so pressures do play an important role. And yes, people who are going into like respiratory therapy, doing respiratory therapy, that becomes very important for them to know, okay? They would need to deal with that, like, you know, our hospitals around here, since we're pretty much at sea level pressure, then they would know how to adjust the delivery of the gases based on that. Okay, but a person who's going to be working at a hospital in Colorado in the Rocky Mountains needs to know to adjust it at that level. Okay, so your textbook is going to talk about pressures, and that P stands for these partial pressures, meaning what is the pressure of my oxygen, what's the pressure of my CO2, and together, all right, pressure should equal 100. So if I have a certain pressure of oxygen, certain pressure of CO2, whatever the cases might be, inside, outside, numbers should equal 100. All right, but that's going to vary. All right, so my goal is to get you to understand what has to happen inside of our bodies for the air to exchange. Okay, for these gases to move. So we left off at the point where we were looking at the makeup of the lungs, and it becomes important when we get to an alveoli. Okay, and there's a lot of branching that's going to occur for us to get to this level. As we start with movement of air, don't forget, we're dealing with cartilage, our trachea, okay, not movable a lot, okay, but as the branching continues to take place into the lungs, we begin to see smooth muscle showing up. We begin to see more elastic tissue, because we need to have that ability for expansion and recoil. All right, so the structure changes just a little bit, but I need to make sure that I can have exchange of these gases across my vessel wall and my alveoli wall. That's where we end up having a little bit of control for the exchange. As we look at this structure that is going to get formed between an alveoli and capillaries that it encounters, we end up creating something called a respiratory membrane. Now, this is going to be a barrier between air in my alveoli and then my blood. What I'm going to have in those capillaries surrounding it. So, here's what it's made up of. The respiratory membrane. And note, they're trying to show you an alveolus. They're trying to show you a blood vessel and the structure that is now formed in between the two. So if I blow that up and look at it here, this area that is formed between my blood vessel and my alveolus creates this structure known as the respiratory membrane. So what I'm going to find, I'm going to have a structure on my alveoli side. And I'm going to have alveolar cells. And then over on my vessel side, I have my squamous capillary cells. Now, what becomes important? Each side, whether alveolus or vessel, one cell layer thick. Because remember, my capillaries, they haven't changed in structure. They're still the same like they are in any other tissue of the body. So that meant they're one cell layer thick. Why? What's important, Nate?
To allow things to go through the membrane.
To allow for movement of materials. Now over here on my alveolar side, I got to deal with some alveolar cells, okay? I've got this shared basement membrane, meaning on each side, I now have a basement membrane, which is surrounding all the tissues, okay? So it now becomes, well, wait a minute, how am I going to get these materials to move from my bloodstream to the lung tissue, or from the lung tissue to the bloodstream across this membrane? Well, one of the things that's going to be important is the structure of that material. We can't simply have these gases just simply moving whatever they want. I know, that sounds very odd, because in my body, aren't I dependent on my gases moving? Of course we are. But does that mean there's no control? No. There is control of this. The structure that we get in this system, have you guys ever heard of pleura? Maybe somebody had pleuritis? No? Okay. When we look at the structure of the lungs, just like everything else in our body, covered in connective tissue. Okay? But with our lungs, let me look here for a second. They're showing me a picture of now collapsed. When you hear collapsed, what would you think of for a lung?
A lung that has no air.
Do what, Nate?
I said a lung that has no air.
Okay, so you would be thinking like, oh my gosh, they have a collapsed lung. No air present. Yeah, okay, don't get me wrong. Yeah, but in our purposes, believe it or not, we have to inhale, we exhale. And they refer to this as either being collapsed or inflated. So when I inhale, I'm inflating. Exhale, I'm collapsing. But that doesn't mean the lung has collapsed in on itself. Does that make sense? All right. So, first of all, let's kind of note that these organs, okay, they're completely encased. They are surrounded by bone. All right? They have this bottom, this inferior portion that is completely covered with the diaphragm. They have no freedom. But wait a minute. Is that completely true? Because my diaphragm is going to have the ability to contract and relax, and then between my ribs are skeletal muscles that can go because of the way that they are arranged. But what it does is it gives restrictions, because lung tissue itself is like a sponge. And without this muscular contribution, so to speak, without this muscular help, they wouldn't simply just inflate out of control. So there are restrictions based on the structure. We're going to have what's termed a pleural cavity. The pleural cavity surrounds each lung, and it's made up of what's called pleural membranes that are filled with pleural fluid. So that material helps these lungs move without creating friction and therefore a lot of pain. People who would have, for example, pleurisy, there would be an issue with the fluid around the lungs, and it's very painful for them breathing. They're usually hospitalized and treated. All right. Now, we're going to also find that we have a wrapping around the viscera, the tissue itself, being visceral pleura, simple squamous epithelium. What was the blood vessel structure? Simple squamous. Yay. Simple lets me know one layer. Okay. I have parietal. Parietal meaning to the outside. Okay. Adherent to my thoracic wall. So when you look at all the structure surrounding them, I'm once again dealing with my three layers. One that would cover the lung tissue directly, one that would cover my thoracic wall all the way around, and fluid in between. So when I inhale and exhale, it's a nice, pretty much fluid movement. No pun intended. Okay? Alex, you have a question?
Yeah, so pneumothorax, is that when the air gets in the pleural cavity?
Yes. and let that air out, because that air would compress the lung tissue and keep the person from breathing. That's why they have to go in